All right, let's dive into a topic that's absolutely at the heart of everything you'll do as a CNA: patient safety, and specifically, the use of restraints. Now, this isn't just about memorizing rules, it's about protecting the very dignity and well-being of every single person in your care. So let's get right into it.
First things first, I want to throw a question out there for you. Can a simple, everyday bedsheet be considered a physical restraint? Just think about that for a second. Keep it in the back of your mind as we go, because the answer might actually surprise you and totally change how you look at the things in a patient's room.
You see, whenever we start talking about restraints, what we're really talking about is patient safety. Our number one goal, always, is to protect our patients from getting hurt. The tricky part, the real dilemma, is making sure the methods we use to protect them don't end up causing harm themselves.
So what's the official definition we're working with? A restraint is basically any method, and that can be physical or chemical, that limits a person's ability to move freely or get to their own body. And here's something you should know. Some facilities might try to soften the language and call them reminder devices or something similar. But don't let that fool you. The principle and the risks are exactly the same.
Because of that, it is so important that you can spot what a restraint is. And this means you've got to recognize the obvious stuff for sure, but also the hidden, more subtle things that can be just as restrictive.
When most of us hear the word restraints, these are probably what pop into our heads, right? Vests, wrist or mitt restraints, lap buddies, even a chair with a tray table locked in place so a person can't get up. These are the easy-to-spot textbook examples.
But, and this is a huge but, the definition is so much broader than just these specific devices. So what else could possibly be considered a physical restraint? This is really where your keen observation skills as a CNA become so important.
And here it is, the answer to our first question. Can a bedsheet be a restraint? Absolutely. If it's tucked in so tightly that a person can't move, it's a restraint. Putting all four side rails up on a bed, that can be a restraint. Even tying a blanket behind a wheelchair so someone can't stand up, that's a restraint. The key is, it's anything that confines a person.
Now, it's also super important to get the difference between physical and chemical restraints. Physical ones are what we've been talking about, the actual devices or barriers. Chemical restraints are different. They involve medications, like sedatives, that are used to control a person's behavior or mood.
And let me be crystal clear about this, because this is a hard, non-negotiable line. Chemical restraints are never to be used for staff convenience, period. Using medication just to make a patient easier to handle is unethical, it's dangerous, and it's flat out illegal.
Okay, so now we know what they are, but we really need to understand why restraints are always the absolute last resort. The potential for harm is just massive, which is why we have to try every other possible option first.
I mean, look at these physical dangers. They are incredibly serious, and they can even be deadly. We're talking about things like strangulation, broken bones, and permanent tissue damage because blood flow is cut off. And on top of that, just being kept still can lead to other awful problems like pneumonia, pressure ulcers, and even fatal blood clots.
And the damage isn't just physical. Think about the psychological harm. Being restrained can make someone even more confused and agitated, the very things we might be trying to prevent. It can lead to deep feelings of humiliation, depression, and a really devastating loss of their independence.
Here's the bottom line, and it's a serious one. The stakes are incredibly high, not just for the patient, but for you legally. All the major regulatory bodies, OBRA, the Joint Commission, you name it, are clear. Using restraints improperly isn't just bad care. It can be considered false imprisonment.
Okay, wow. So if restraints are that dangerous, what do we do instead? Well, the better solution, the only solution really, is to shift our entire way of thinking. We have to prioritize finding and using alternatives to restraints first. This is the bedrock of modern, compassionate healthcare.
The professional standard of care follows a pretty simple three-step process. 1. Create a safe and secure environment. 2. You must look for and use alternatives first before a restraint is even considered. And 3, and this is crucial, you have to document every single alternative you tried. In healthcare, if you didn't document it, it didn't happen.
So what do these alternatives actually look like? Well, sometimes it's as simple as giving someone frequent attention or just some gentle reassurance. It can mean getting family members involved. Their familiar faces can be incredibly comforting and reduce a patient's anxiety. We can also use things like postural supports. Think of special pillows or bolsters that help with positioning without actually restricting movement.
So this all brings us to your specific role in all of this. As a CNA, you are right there on the front line of patient care. Your ability to observe what's going on, provide care, and report any changes is absolutely essential, especially when a patient might be restrained.
Now, there are two rules here that are basically set in stone. You need to burn these into your memory. First, only a doctor can order a restraint. This is never a CNA's call to make. And second, you must know and follow your facility's policies on restraints to the letter. There is zero room for making it up as you go. Now, if a patient is in a restraint because of a doctor's order, your job is to be incredibly vigilant. You are the eyes and ears. You have to report any of these signs to the nurse immediately. Any trouble breathing? If a hand or foot below the restraint looks pale, blue, or feels cold, if they complain of pain or numbness, if you see any red or broken skin, or if they suddenly get more confused or agitated. These are red flags for serious complications, and you acting fast could literally save their life.
So as we wrap this up, I want to leave you with a question to carry with you as you start your new career. You're not just learning a bunch of tasks, you're becoming an advocate for your patients. So how will you, personally, champion a culture of restraint-free care, one that puts dignity, safety, and compassion above everything else?